Hi, everyone. I'm Priya Parikh. I'm a pediatric hematologist oncologist, and I'm thrilled today to be able to speak a little bit on our project entitled Characterizing, Clinical and Patient-Reported Outcomes in Latinx Individuals with Sickle Cell Disease. I'm presenting today kind of on behalf of myself and my co-authors, as well as the SCDIC. So just for a little background, we'll spend a little bit of time here. I won't go too much into physiology or biology today of sickle cell disease, but as many of us know, SCD is a disease with longstanding implications related to several factors, related to migration history, populations affected, sort of the complex disease state that it is, as well as really importantly, systemic concerns, which include systemic racism. And this kind of mix of factors have led to longstanding health disparities. The two most affected groups in the US are Black African Americans and Latinx populations. And this is a little bit of an older statistic, but in 2015, the overall US population of Latinx persons with sickle cell disease was estimated at nearly 9,000. There's a couple states that sort of have the highest prevalence, including California, Texas, Florida. Another sort of interesting fact, as demonstrated in kind of a larger study, is there's about 22 countries of maternal origin represented in the US when it comes to sickle cell disease. So we see quite a lot of phenotypic diversity coming from places like Africa, coming from Latin America, North and South America, the Middle East, the Caribbean. So really kind of understanding the diversity within sickle cell disease, as well as studying a Latinx population, is sort of a time-sensitive question. And currently, as it stands, there's very little published on sickle cell disease in Latinx individuals, and this is sort of the gap that we're trying to fill. To continue a little bit onwards, we know that for the general Latinx population, there are known health disparities when it comes to a comparison with a non-Latinx white population in mental emotional health, healthcare access, and health outcomes. We have had the really unique opportunity to closely examine a cohort of Latinx adolescents and young adults living with sickle cell disease through the SCDIC, and we've heard some wonderful kind of talk from Tabitha already about SCDIC and sort of the data that we have there. And I think a really unique aspect of this as well is our data spans several geographic regions across the US. So able to capture that in a little bit more detail kind of throughout the country, especially as we know that there are regional differences. And, just one other side note here, terminology kind of has encompassed a variety of pan-ethnic terms. We've heard the Hispanic term and Hispanic ethnicity so far in this presentation, but you'll hear me kind of refer to this population as the gender neutral Latinx community, just in accordance with JAMA standards that have been emerging. That's a decision that myself and my co-authors made. So just so you know, that's kind of how you'll hear me referring moving forward. Our objectives for this study, really kind of the main question for us was, what are the clinical and patient-reported outcomes for a Latinx cohort of individuals with sickle cell disease within the SCDIC? And kind of getting to, what is the impact of sickle cell disease in this specific patient population? We had two big aims. One was really to characterize the clinical outcomes, including many SCD-specific metrics, things like pain events, use of hydroxyurea, disease-modifying therapies, access to care. And then a second kind of, rich way to explore the data was to really characterize impact as we could through patient-reported outcomes. And these include psychosocial, emotional, mental health measures, in addition to physical health measures. And I'll get into the specific patient-reported outcomes that we are looking at. As an overview quickly of our method, so we are utilizing data from both SCDIC-1 and SCDIC-2 registries. Our first aim, sort of looking at those clinical outcomes, comes from baseline data for participants within the registry that have both patient survey data as well as medical record abstractions. And then for our second aim, as we go into kind of understanding patient-reported outcomes, our goal has been to build multivariable models looking at the following. So you'll see 5 different outcomes listed here. As Tabitha kind of already mentioned and described a little bit for us, these are validated health measure tools that get into different patient-reported outcomes. ASME is a sickle cell related one, so we have kind of adopted that through the SCDIC, and the ones that we kind of picked for this project are the ones you see here, but really getting into pain impact, cognitive function, social functioning, and then emotional impact and emotional distress. I'm excited to share some preliminary data that I have for you all today. This first slide kind of gets into the baseline data and frequencies for participants in SCDIC 1 and 2 that were kind of ready for this analysis. So we had almost 1,700 patients included in this cohort, and you'll see about 141 of those identified as Latinx. Next, I have a lot of numbers, but these are some of the baseline demographics and other characteristics in our Latinx and non-Latinx cohorts. And really here, kind of wanting to understand, are there similarities between these different metrics as it relates to sickle cell disease? Are there dissimilarities? You know, I found, and you can probably see, I know there's a lot of numbers here, that there's a lot more similarities than dissimilarities. And a couple kind of interesting areas just to keep in mind as I look through these are some differences in health insurance breakdown, in hydroxyurea use, as well as in ASME MHC, which is sort of a medical history measure in which there's slightly more severity actually noted in the Latinx cohort. As I mentioned, part 2 of this project, which for the sake of time, I don't have time to get into today, but please do stay tuned if you're sort of interested in this work. We'll of course be exploring the models and more in our paper, but part 2 kind of involves modeling the SCDIC data to examine the patient-reported outcome portion more carefully. And we did so kind of using a clinically significant list of covariates as it relates to those patient-reported outcomes. You'll see here on the left some of the, again, baseline frequency data as it relates to the patient-reported outcome. The scoring is a little bit different for each of these measures, so I won't get too much into that today. But again, if you're interested, we're excited to continue along this work, and that's sort of the part 2 and aim 2 of our project. And then, you know, really, where do we go from here? I think as a group, we've talked a lot about it is and it will be so important to contextualize findings from this study with already what's out there in terms of institutional reports, surveillance data, and taking into account the larger sickle cell disease community, certainly as well as the Latinx community. I would say I would advocate for more investigation and inclusion of the Latinx population when considering sickle cell disease studies, especially as we know demographics and migration patterns continue to shift here in the US. So will be important to continue to keep that in mind. And as a clinician, I always think about, you know, how does this kind of bring us back to the patient care? And I think, you know, these topics of inquiry and investigation can really help, you know, those of us that take care of patients and individuals with sickle cell disease better. I think having more information on how to do that is always helpful. And I think that we'll find kind of as we continue along in investigation that there's going to be further areas to look deeper into. And for me, always the goal, kind of bringing it back to a health equity lens of how can we lessen disparities when we do notice those or we see those arising. And I have here a list of references just as it relates to our work. And lastly, I will just say thank you so much for your time and for your attention, as well as the invitation to speak today.